Good morning, everybody. We continue to talk about the coronavirus this morning. It's been a busy 48 hours, needless to say. We're getting questions on spotting the differences between the common cold, influenza, and COVID-19. So this morning, we're bringing in Dr. Brett Belchetz. He's an ER physician in Toronto, joining us via Skype from New York this morning. Good morning, doctor.
Good morning.
So good to hear from you because we really need the facts out there. So what is the difference between a common cold and flu, allergies, let's throw those in there too, versus the regular flu strain we've been seeing and COVID-19? What is the main differentiating factor?
Well, it's a really good question, and I'm glad you're asking that because many patients are very panicked at the first sign of any symptoms, whether they be a runny nose, typical allergy symptoms, or your regular cough and cold symptoms. So it's important to note that COVID-19 is presenting somewhat differently from what we would expect with those more common types of infections that we're all used to. COVID-19, the hallmark symptoms right now are a dry cough, shortness of breath, and fever. And then down the list are all the other kinds of flu symptoms like muscle aches and weakness and the things that most people would get with the flu. Now, what's really important to note is what you don't typically get with COVID-19 is sneezing, runny nose, all of those things that you would usually get with a cold or allergy. So one of the first things that we're asking about when people are presenting with a history that might be suspicious for this is, are you getting those typical allergy or cold symptoms? And if the answer is no, typically it's quite unlikely that it is COVID-19.
Okay, so what if you do suspect that you might have COVID-19? What is the first step we should be taking?
Well, the first step is to make sure that there's no critical health emergency. So if you are somebody who's having mild symptoms, you're breathing comfortably, you're eating and drinking okay, there's no other symptoms that are making you concerned imminently for your health, what I would recommend then is taking your time, looking up the public health resources in your area, reviewing what is recommended. Typically, there are a number of hotlines, there's websites, there's Telehealth Ontario that you can call, where you will be given advice as to how to proceed to actually get yourself tested. Most important thing is before you rush yourself into a doctor's office, you want to phone ahead, you want to get that advice, because the one way that you get a lot of people sick is when you walk with your symptoms and your potential for infecting others into a crowded waiting room situation. If, on the other hand, you are worried imminently about your health, so if you're one of these people, as I said, that is critically short of breath, there are other things that are going on that are getting you very worried, then you should be calling 911. But make sure during that 911 call that you are letting the operators know that COVID-19 is something that you are concerned about. And that way, if they do dispatch paramedics, those paramedics will be able to take the right steps to protect themselves.
Now, we hear a lot about self-isolation. What does that entail if you are living with a family member or many people in the same household? Do you designate a room? How do you ensure the safety of the rest of the people you're living with?
So self-isolation is a really difficult thing to practice when you live with others, but what that usually means is that the person who is isolating should be in a room on their own. So if you share rooms, make sure that person is no longer sharing a room. That person, if they ever do leave that room, should be wearing a mask so that if they cough when they leave that room, they are not spreading infection onto surfaces in the rest of the home. In the home, wherever that person has been, there should be rigorous sanitizing of surfaces. So pretty much every surface needs to be cleaned. And you can use things like 70% alcohol solutions. You can use things like Clorox wipes, etc. Make sure before you're using alcohol or Clorox that you do just clean with regular household cleaners, because if you go straight to the alcohol sanitizers or Clorox, what can happen is viruses can hide out in the household dirt that wasn't cleaned away first. So do a thorough cleaning of surfaces. And then what you want to be doing is for that person that's in isolation, you want to make sure, obviously, that they have good supplies, food, drink, etc. But don't be bringing it into the room. You can leave it outside the door for them. Make sure that when they're bringing it into the room, they're opening their door but not touching the exterior of the door so that they're not putting infection on the outside surface of the door. So there are a lot of very careful precautions you can take, but if done properly, it is actually quite effective.
Great tips. I know you were part of the front lines during the SARS crisis in 2003. How are you preparing for this as we start to see it more and more in North America?
I think really it's all about setting up systems to respond to this as early as possible. And I think luckily SARS helped us to have a head start on this. Many of the procedures that we have in place to protect frontline staff just weren't there when we started out with SARS. So we now know what is the protective equipment, what are the processes. We have very different physical setups that help to protect frontline staff. we're already working on setting up procedures that can actually keep a lot of the suspected COVID cases that aren't critical out of emergency rooms. So we're starting to set up things like drive-through testing centers and other types of modalities where people can go get their test without exposing others. So we're doing lots of different things that I think really differentiate our response from this to our response to SARS. And I am hopeful that our healthcare system is far more prepared this time around than it was during that outbreak, which was certainly something that I think was terrifying to all of us and resulted in a lot of needless exposure and illness, not only among healthcare workers, but among people visiting healthcare facilities.
Dr. Brett Belchet's on the line from New York City. Thank you so much for all the work you do here in Toronto and all of the frontline workers that always work so hard every day for our health and safety. We'll check in, I'm sure, in the coming days and weeks. We'll be back with more BT right after this.